They came on foot with wheelchairs, canes, crutches, and any other means possible. Help has come. Most came to see a dentist, and many teeth were extracted. A service so simple but is difficult to attain in Touws River. Community members say a dentist only visits the town once a month and sometimes every other month. The nearest big medical facilities are 100 kilometers away. With over 90% unemployment and most people living off grants and food aid, there is no money for luxuries such as a dentist.
I'm come to remove his teeth and we struggle. We couldn't afford to go to private doctors. So I'm very thankful and very relieved. I can sleep peaceful at night without painful teeth and gums.
The young, the old and everyone in between came to see, from physiotherapists to nutrition experts. There's only one clinic in town and no permanent doctor.
If you attend our local clinic, you must get referrals from the sister to the doctor. And sometimes it takes up to 1 month before you can see a doctor. Sometimes somebody's condition may be so seriously, but you must wait for 1 month or more to see a doctor.
The outreach program comes after the latest visit by Gift of the Givers in recent weeks. During that visit, the great need for healthcare became apparent.
And the clinic try their best with the limited services they have available, but the amount of people that require services in town are suffering. People have to wait over a year just to see a physiotherapist or have their eyes checked or even get an appointment at the hospital. You must be in dire need or there must be a real emergency before you can actually help at the hospital if you have no appointment.
For some, like Margit Harley, the generosity was overwhelming. She's been waiting for a wheelchair of her own for more than 2 years. The organisation also came to assess the overall health of the entire town's population. COVID-19 has exacerbated the problem.
The first thing the community worker told me when I walked in, he said people in this area are not used to anything like this. Of course, nobody's used to anything like this. But what she meant is they never thought people would take care of them. That such a big number of medical people will come, that they are actually important. You're telling the psyche, you know what, you're not forgotten. You are important. We just didn't know. And that we are here, we can't be every day. But we can take the stats and go to the health department and say, look, we got the stats, we did the survey, we need more decisive intervention. You got a clinic, take doctors from somewhere else and bring them there. That's the job of government. And make sure we're doing the assessment and let's follow that up.
By midday, the team had seen over 500 people for medical care, including the dispensing of medicines such as antibiotics. The organisation says within the next few weeks it will arrange for a mobile eye clinic to visit the area. Mariska Botha, SABC News, Touws River in the Karoo.